Good afternoon. So welcome again. It's good to see such a big crowd. We're quite thrilled to see the level of interest for a meeting like this during the summer in Washington, D.C. on a Friday. So thank you for coming out. And we are quite excited with the panel that we have today, and I wanted to welcome you to what looks like it will be quite an engaging discussion on oysters, octopuses, and resilience. And I suspect that some of you came today just because of the title. As a matter of fact, a friend of mine said to me, and I'm not going to identify her, but she's in the audience today. She said, "This sounds like it should be a cocktail reception with some delicious appetizers. Sustainably harvest, of course." All I can say is that we're certainly in for a treat. And this is such a great topic for us to explore here at the center. Independent research, open dialogue, actionable ideas. This is what we're about here at the Wilson Center. And as many of you know, the Woodrow Wilson Center is a formal memorial to our 28th president. And it's meant to be a testament to his lasting legacy as the only president thus far to have achieved a PhD, and also recognition of his role as a president who brought together the worlds of policy, practice, and academia. The event today is brought to you as part of our HELPS project. HELPS, which some of you know, stands for Health, Environment, Livelihoods, Population, and Security. And it's a 5-year effort that's generously supported, funded by USAID's Office of Population and Reproductive Health. And it's part of a 19-year program that we have here, the Environmental Change and Security Program. So we're very excited with our lineup of speakers, and I'd like to start by just briefly introducing our first speaker. Fatou Janha is the founder and leader of the Oyster Women's Association in the Gambia. And Fatou founded the association in 2007 to empower women oyster harvesters. Has a very strong community-based focusing on raising family standard of living while engaging women in more efficient, productive, and sustainable methods of production that preserve and protect the ecosystem. And as you see, as you look at her bio, she has a very strong background as a volunteer and as a homemaker, having worked on a number of women and girls empowerment projects throughout the Cameroon, Ghana, and Tanzania. In a former life, was formerly a teacher, and I say formally because those of us who have taught always carry that as we move forward in our career, and has also worked as a government agricultural extension worker. And in chatting with Fatou, she was telling me how excited she was to be here with us in Washington, D.C. She said she frequently comes or has come to Washington for a number of meetings and is really thrilled that you're here with her today. So Fatou, I'll hand it over to you.
Well. Well, first of all, I would like to say a big thank you to Wilson Center to have invited us to this meeting today to tell our story, all the way from Africa, from West Africa. So thank you very much for inviting us, and I hope you will enjoy my speech, my talk. So I'm here today to talk about the Oyster Women Association of the Gambia. Now, as you can see in this picture, these are women, poor women. And when I say poor, the poorest of the poor in the Gambia, who have been marginalized for a long time. So what they do is they fetch oysters from the mangroves, they process, and they harvest, and they process, and they sell. They sell on the roadside, and they also do many things to maintain the healthy mangroves. So, but it's been a long time. Nobody knew what they were doing. People just bought oysters and passed, but they didn't look behind to see whom they were. And these women, they are all illiterate, but they understand climate change. And they understand that they have to protect and nurture the environment under which they earn their living. So, ladies and gentlemen, this is the Try Oyster Women Association. When we say try, you may wonder, what is try? What does it mean? It's nothing. It means try, as in trying. They're trying to uplift their lives. So that is what meaning of try. Thank you. Now, I don't know who has been to West Africa and to the Gambia before. Have you? Good. At least you have 2 people here. But I want to say this. The Gambia is a very small country surrounded by Senegal. It is not in Ghana. It is not in West. It is not in Nigeria. It is not in South Africa. It is not Zambia. It is called the Gambia. The Gambia. So please, it's a very small place and a very nice, as you can see the way it is, we call it the smiling coast of West Africa. It's a very hot spot for holiday, and we have beautiful beaches and very nice people. So for those of you who would like to go to West Africa, don't go to Ghana, come to Gambia and have holidays. Okay. So one of the first things I would like to emphasize here before I start my talk is that I want to tell you that we are very proud. You have seen what we have showed to you. I'll come to that later on, that these poor women have come together and echo themselves, echo their voice, and they have worked hard to maintain, to preserve the mangroves in the Gambia. And for the first time in Africa, in West Africa, in Africa, if I like to say in Africa, that the women of this caliber have been given the exclusive right to manage the natural resources of this country, mainly the fisheries, the oyster and cockle in the country. So we are very proud of that. And then, and also, this is another thing, we have also achieved the UNDP Equator Prize in 2012. Now, you asked me, how did we get this? Now, this is from 825 projects. Try was able to showcase what they have done for the environment and for themselves. So based on that, they were awarded this UN Equator Award Prize in 2012. We are very proud of this. We are very, very proud. So now, we are not a health organization. We are not. So I'm sure a lot of you will be expecting me to talk more on health. But I want to also tell you that for you to have healthy people, you have to have a healthy environment. So we try to put it together. We are mostly on, we talk about the sustainable stewardship of the environment, but we say that we can't afford to have this if we don't have healthy people. So that was how we try to integrate health into this, our program. But mainly it was only on the environment and the mangroves in the Gambia. Now, as I said, these women are very poor. Now you can see this surrounding, very, very poor. See this lady, she's now getting ready to go to the water to fetch oysters. Now she doesn't have the socks to wear, the proper gear, working gear. She's actually preparing herself, tying her feet with a piece of cloth so she can go to fetch oysters, so she will unharmed by the oysters. You have seen this surrounding. Now this woman goes to work as early as 6 o'clock in the morning and comes back at 8 o'clock in the night to fetch for the family. They are mostly the breadwinners of their families. They all go get money, get oysters today, tomorrow they process it, and then they sell and give their children lunch money, food, and the next day so that's their life all the time. 70% of their time they spend it outside in the water fetching for food for their families. So then in this case we realized this is where I came in. When I passed by, I always passed by and bought oysters. But I did not, ever since I was a little girl, I used to go to buy oysters. And as far as I remember, it's under the same condition, the same little cup they sell to me. and the same environment, same surrounding, there was no improvement. So I wondered to myself, how come nobody has really come to their rescue? How come nobody has done anything for this woman? So that was how I came in and decided to organize them. We realized that organization was lacking there. They were all working in clusters all over the bush. So I came in and then decided to work with them. And then what we did was, first of all, was to organize ourselves. Now this is a great thing, because for them to come together, for someone to put them together and let them organize them and train them was a major achievement we got from this woman. So, as I said, what did we do to improve? What did we do to improve their conditions? First, we had the co-management plan. I think we have the papers outside there. If you have a look at it, you will get to understand more, because I can't go into details. If I do that, then I will take all the time, and they will be angry with me for taking their time. But we had a co-management plan. We brought in the government, the fisheries department, the NEA, that is the national environmental, those who protect the environment. We brought the fisheries department, the forestry, and the parks and wildlife. We set up a co-management plan where we will all work together to help this woman. And that's how we started to change the conditions, to improve the conditions. Today, I have all that, but I'm not going to talk about everything, because then we'll spend a lot of time. But what did we do to improve this condition? First, we had the value chain improvement, that is adding value to the oysters, because they sell the oysters in cups for a very little amount of money. So we say, okay, we have to do something to change the attitude, to change the presentation, to change the chain, so that we'll get more income from the oysters. And then, so that was the first thing we did. Then we also taught the women to understand that we have to maintain the mangroves. We have to replant the mangroves every year, because for us, the mangroves are very important. They are, this is where we have the estuary of the River Gambia, and this is the spawning space for the small fishes. That's where the nursery ground is, and then they go to the big sea. That's the fish and the shrimps that we eat. So we let them understand the importance of the mangroves. So we allow them, every year, we come in and replant the mangroves. And we also had something like the microfinance organization for them. These women, they have never saved money before. They come today, get what they have to get, and then tomorrow they go and give their, provide lunch for their families. The next day they are gone again. So they don't know what it meant to save money. So we introduced these savings, teaching them how to save. And as you can see, this woman, she's never saved before. She didn't realize that she could have such money. She's a very happy woman from this. And we also did, adult literacy, because these women cannot read or write. They go to the hospital, they don't know where is room 1, where is room 2. So these were the basic things that we taught them so that they can understand. So now, the health statistics. As I said, we have incorporated health in our mission, because we believe that without good health, you cannot do a good job. So as you can see, in the Gambia, the population of the Gambia is 1.8 million. And it is projected that in 2050, by 2050, we'll have double or more the population. So why do we do this? We said, okay, let us try to train these women, especially the women like me and you. We know how to plan our family. We know how to go to the family planning. We know what to do. But these women, they might even want to know, but they don't know. They are not informed. So we try to organize lectures, seminars, to train them as to what they can do, and inform them of what the benefits will be in planning their families. So as you can see, I mean, we talk about literacy rate in the Gambia, but when we talk about this, it's about the Gambia, the average Gambian, not the local women who can read and write. So these are some of the things that we had to address. Now, how did we get into this? First of all, the women said to me, Fatu, we need to, you have to do something for our girls, our young daughters, because these children, they are mostly dropped out from school due to various reasons. One, maybe they can't pay school fees for them, or they've gone through early pregnancy. Now, mainly because the mothers spend a lot of time outside their home, fetching for them. So there is lack of supervision in the house. So as a result, these children will go out and they do anything to get something to eat, and then they get pregnant and they fall into trouble. So we organize health, we have a skills center which was organized, which was through the help of the local community. We didn't have any donor helping us to do this. It was the local communities that came together and came to our aid. So we were able to have a skills center where we taught them how to do business cooking, tie and dye, soap making, things that would generate funds so that they can also go and do business and be able to say no to whoever, and then to take control over their lives, to be able to help their parents so that they can help their younger siblings. So this is one of the classes, and you can see here, we engage, we cannot do it all because we are just two people in this office. So we invite the family planning office, we invite other government institutions, they will come and help us in such seminars. As you can see, these two girls, they do step plays on how to say no, how to take control over their lives, how to protect themselves. So that's the type of thing we have been doing with them. And now this picture, I don't know what you can tell me from this picture. This lady, as I said, these women are very poor. They are always looking for something to take home to give to their children. This lady, we are doing mangrove planting, because we do, as I said, once every year in the rainy season we do mangrove planting. She came, she appeared, and she said she wanted to do mangrove planting. We said, no, but we don't need you. You are very pregnant. She said, no, I want to be here. Why do you want to be here? Because we are giving them an equivalent of $5 so they can go and cook the next day. Every time we have this, we have $5, give it to each other, maybe sometimes $4, depending on whatever money we had. This lady had to come that day for that $5. You know what? She got the baby that night when she went home. And that baby is called Atutu. Atutu meaning plant in the Amaninga language. So, but as you can see, she's very happy. I mean, they are very happy people. They have no stress. They are stress-free. Even though they are poor, but they are still stress-free. So this is one of the babies now in the center. We call her Atutu. So another thing, what we do is after we finish the girls, the women saw that their girls are well informed now, and then they are confident, and they were very happy with their daughters. So they say, okay, Fatu, now we the mothers, we want to come in, because there is no point you teaching our children, and we are not taught. We want to come in for these seminars. So we said, okay, why not? Then we started organizing them. Now this was through the Peace Corps volunteer we had in the office. She got a small amount of money, was about $60 for each session that we can give the lady. This is from the family planning. We give her a little token amount so that she can pay her transportation back, and we cook a little bit of food for the women to eat. So they come in and they listen carefully and they enjoyed it. These are seminars. She is there from the family planning, and she's teaching them what it means, what family planning means, how to protect themselves, and how to think, how to see their bodies, the STDs, everything was being explained to them, which they never knew. So this another one is the SOS clinic doctor. He comes in to talk about cervical cancer, menopausal problems, which the women don't understand, unfortunately. They don't understand what happens in their body. They don't understand that they have to go through these changes. So they always attribute these symptoms with spiritual reasons. So this was a great enlightenment to them, because we showed them what it meant, how to take care of themselves when menopause is around, and also how they can go to the clinic for them to have to be screened. Because under normal circumstances, they wouldn't think about that. They don't even know. And then the way it is in the Gambia, like in all African countries, most African countries rather, we have very many patients and few doctors. So doctors and nurses never have the time really to sit down and talk to patients, to explain to them what to expect. So this is one of the things, and I'm proud to say that after this session, all of them went to the clinic for screening. So some of them had some small problems, but at least they were able to get treatment for that. So another thing we do is this, because as I said, they're illiterate, they don't read or write. We organize seminars, we get them videos in the vernacular languages, and they listen, they watch the videos, and as you can see, They sat at the back, but they were so engaged. They listened carefully, and they enjoyed it, and they were enlightened. So these are some of the things that we do with them. And then one of the things here that we have been having problems with is the mindset, change of mindset. Now, this is what we had before. This is a toilet, and the waste is in the water. And this is where the oysters are. So, but they didn't know any better. They thought that was the best thing to do. So through the education that we give to them, the training, they understood the value of this. And now with the intervention of WASH is a water and sanitation hygiene program run by the Banafa project, sponsored by USAID. They started building us toilets like this. In this toilet, it's not finished yet, but it should be ready by now. And there is running water and there is toilet, so women can come in and ease themselves and take shower and be clean before they handle food stuff. So, as we say, what is the result of what we have done so far? Am I on time? I'm doing good?
You're very good.
What is it? Because we have so much to talk about. We don't. I can talk to tomorrow. I mean, but so this is what we have achieved so far from the little we have done. We haven't done much. We are not. We're trying. But we have now, I'm proud to say that, look, the mangroves have been, as you can see, it has been, now there is proper management. The women they don't go to the mangroves every time. There is a co-management plan where they can just go harvest oysters 4 months of the year. And then also they understand the value of the mangrove. Before they will come and chop down the mangroves, they will put use the sticks for firewood or for house, building their homes. Now they understand, and they actually police the mangroves themselves. They will not allow anybody to come in to cut the mangroves. If they do, they will call the police. So that is one major achievement we have got. Another thing is that the price of oyster has now been increased because we have really gone out to show the population that this is what the women go through, and people must appreciate the price of oysters, and they should pay more for that. So these women are now, at least they can pay school fees for their little ones to go to school, and they are happy to say that, look, we are now comfortable, we are very comfortable, at least we are better than what we were before. Then also we have trained their daughters. Last year we trained 15 of their daughters in a 2-year program. So these girls can go out and look for jobs. They have certificates. They go look for jobs in the hotels, or they can do their own business, and they can address their problems and help their parents. And also the women, they now know, you ask them what is menopause, they can tell you what menopause problems is about. How do I go to family planning? They know how to go there, they know what to do, and which before they didn't know. And then again, they have control over their lives now. This is very important. Before they were very shy. They wouldn't talk. They were just like, you can't make them talk. But now they are very, very confident in themselves. And as a result, we have this is a picture. This is my best picture, because this is the women now voting. And when they vote with 2 hands. Here we vote with 1 hand. They vote with 2 hands. Now this, as you have seen here, this is a slogan that was said by one of the women. It said, we have now reached grade 12. We don't want to go back to grade 1. Meaning that they have now acquired lots of knowledge, and they are now going to abide by those rules. So ladies and gentlemen, this is Try Oyster Women Association voting with confidence. And I want to also to close my talk, I want to thank all those who have helped. Well, these are all people who have come to our aid, and we are very grateful. So thank you very much for your attention.
Thank you very much, Fatu. I think we would all willingly have you talk till tomorrow. That was great. I just love anybody who starts a presentation by saying, well. And, as I said, the teacher always comes through. Thanks for that geography lesson on the Gambia. There might be a quiz at the end, we'll see. But thanks for just really emphasizing why you all call this the smiling coast of West Africa, and for really allowing us to see the story behind these women. There's sort of some key components that came out for me in your presentation. The question of rights, and sort of recognizing that women of this caliber had unprecedented rights and what that meant. The question around livelihoods, as a critical component of really empowerment that came through so strongly. The information and approaches that you shared around providing information and training and access to services, and ultimately what that meant in terms of decision making, and then your final point around the wonderful story of the baby at two. You're pregnant, why are you here today? But the intergenerational component in making sure that the young girls and women who went through this program got certification that allowed them to move forward. So thank you. You're a wonderful storyteller, and you captivated us all. So thanks again. Vic, you have some competition. I was going to say it's my pleasure to introduce you to one of the nicest, most passionate, most articulate guys that I know. Dr. Vic Mohan, he's the medical director of Blue Ventures, and is really being the architect behind the integrated programming on population health and environment in Madagascar that Blue Ventures has been implementing. Vic is a practicing UK-based general practitioner and with a passion for marine conservation, a keen diver, and really was going out to coastal communities in southwest Madagascar, engaging on marine conservation and recognize that, wait, these communities really have some critical health needs, and there's a unique opportunity to work with them and engage with them on these issues, and that it was around a high unmet need for health care, around family planning and sexual and reproductive health services. So Vic really has emerged as a medical doctor who's a keen diver, a conservationist, who is engaging the community directly in a very hands-on, participatory way. And I'm sure you will enjoy his presentation, as I have several times in the past. So Vic, hand it over to you.
Thank you. Right, good afternoon, everybody. It's really, really exciting to be here. I've been waiting for this for about 4 years now. So thank you very much to my friends at the Wilson Centre for inviting me, and it really, really is a pleasure to be here and talk to you. So as Roger Mark says, I'm the medical director to Blue Ventures, an organisation that's dedicated to working with coastal communities to enable them to manage their marine resources in a sustainable way. And I'm going to describe to you our population health environment programme in Madagascar, and tell a story about how we started with Octopus, but actually it's led to us enabling us to do things that we never imagined we would ever be called upon to do. And that's why the talk is entitled From Octopus to Disaster Relief. All will be revealed. So we work in the remote and isolated southwest of Madagascar. Madagascar is one of the poorest countries in the world, and the southwest, the communities who live in the southwest are amongst the most marginalised in the country. Along that southwest coast, you will find the 4th largest barrier reef system in the world. And the biodiversity that Madagascar is famous for, the terrestrial biodiversity, is mirrored in the oceans of the southwest coast barrier reef system. We work with coastal communities that rely exclusively on the marine environment for their livelihood and indeed for their cultural identity. As you've already heard, we started with Octopus. I'm not going to go into the details of that too much because you'll hear about that later. But working with the community, we were able to support their octopus fishery with really spectacular results. And what this did was, firstly, it demonstrated to the community that we were there to support them, but crucially, it demonstrated to them the benefit of managing fisheries in some way. And they saw that, well, if we can do this with octopus, maybe we can do this with the rest of our fishing as well. And it encouraged them to think more broadly about how they could manage their fisheries. And so the idea of a locally managed marine area was born. And now Blue Ventures, thanks to this initiative, manages the largest network of locally managed marine areas in the Indian Ocean, all designed to enable communities to live and manage their marine resources in a sustainable way. And so this is a picture just demonstrating us working with the communities to develop locally managed marine areas. Now this initiative is complemented by a program of community-based aquaculture. What you see here is a woman harvesting sea cucumber, and she's pretty pleased about it, as you can see. And in addition to this, we also grow seaweed. So these two alternative livelihoods, as well as offering a valuable source of income for communities, and for women in particular, they provide an alternative to fishing. So they reduce reliance on fishing, and they reduce pressure on that coastal environment, thus enabling us to live more sustainably in that area. Now, as Roger Mark has already mentioned, I'm a doctor, and I'm interested in the health of those communities. And through our work with those communities, we unearthed a huge unmet need for healthcare and health education, and family planning in particular. So with virtually no access to family planning at all, and with no sexual health education anywhere in the community, girls are having sex as young as 8. Girls are having children as young as 11. Most girls have had children before their 16th or 18th birthday. The average fertility rate is 7 births per woman. We've got a woman in our area with 26 children. 1 in 20 women in our area will die in pregnancy or childbirth. 1 in 5 children will not make their 5th birthday. Okay? Shocking maternal and child health mortality figures. 7 children per family. Quite apart from the huge health, social, and economic pressure that puts on families, on communities, the population of the region was doubling every 10 years. Fishermen were working hard and harder to catch fish to provide for their growing families, were competing with more and more fishermen and working further and further down the food web, catching smaller and smaller fish. So despite our best efforts, this was not a sustainable model. So, in response to an unmet need, and at request to meet that need by the communities we partnered with, we started offering family planning services to those communities, and very much within a rights-based framework to offering those services. And I was there the very first day. We flung open the doors to the first clinic, and on the very first day of the very first clinic, 20% of all women of reproductive age came asking for contraception. We worked until it was too dark to be able to see our women anymore. We had no electricity. So we worked and worked and worked, and we saw all of them. We clearly had unearthed a huge unmet need for family planning. And what we very soon worked out was the need was the same throughout the entire region that we were working with for our conservation work. And basically the story since 2007 has been a story of scaling up this intervention to provide these services for all of the women that we work with in this area. We have 3 methods of service delivery. What you see here is our clinical technician offering a family planning clinic. This woman was 23 and she'd just given birth to her 4th child and wanted to use contraception for the first time. So Fanza, or our clinical technician currently, travels from village to village offering outreach family planning clinics to those communities. And currently we cover about 10 clinics that way, 10 villages that way. Great. But we work with 40 villages for our conservation work. And some of those villages are very hard to reach. So what we've done is we've recruited, trained, and assessed 33 women who are not healthcare professionals, but representatives from their community. We've trained them to provide basic health services to the communities that they live in. We provide supervision, we provide ongoing training and support, and we quality assure the quality of work that they do. And what that means is all the women who live in our 40 villages are no more than 5 kilometres away from a service point for family planning. We also now offer maternal and child health services. We offer antenatal and postnatal care and education, and we try and partner with the existing state services such that there are to provide safe birthing and to provide immunisations for women and for newborn children. We also do WASH. Some interesting parallels there, huh? So water, sanitation, hygiene. Here you see one of the wells that we've drilled. So we've drilled wells, we've built hand washing stations in school, and lots of education. We've, for example, we've launched a community-led sanitation program where we empower the community to improve their sanitation practices. And as I've already alluded to, all of our health interventions are complemented by a rich and diverse program of community health education. And here you see an artist's interpretation of our village outreach tour, where we travel from village to village offering educational programs to the community, school-based, youth-based, and for the entire community. And our education is a good example of us integrating, because we deliver messages across disciplines, whether it's health, whether it's livelihoods, whether it's conservation. And we take a conservation staff member and a health staff member, okay, and we deliver these messages. And where we can, we integrate those messages. What does that mean? It means that when women come to hear about family planning, they also get to hear about fisheries. It means that when men come to learn about fisheries, they hear about contraception, probably for the first time in their lives. So we reach broad audiences with these diverse messages. And what's most exciting of all is that we can deliver messages that integrate those messages, those points, so that now the community can see better than ever the link between family size, population growth, food security, and biodiversity conservation. And because we do it in an integrated way, we save money, because we can share resources and opportunities across projects. So, how well can a conservation organisation do at providing health care? Can we have an impact? Well, we think so. The dark blue line shows you that the proportion of women using contraception has gone up more than 5-fold in the 6 years since we've been operating this program. And mirroring that, the birth rate has fallen by 40% in those 6 years. And this is because of voluntary, rights-based family planning service provision. Okay? So we're really, really excited about this data, and you're one of the first audiences we get to share this with. So I feel very excited to share this brand new data with you all. Really, really exciting stuff. Now I'm gonna take a few risks here and go beyond the data. I visit Madagascar every year to see how the work's going. And what I see, and I can't back this up with data, but what I see is that women are healthier, children are healthier. What I feel is that women are more empowered. Women are now taking an interest in biodiversity conservation and resource management for the first time. And what I believe is that sense of empowerment they feel because they've got control over their fertility will spill over into that sense of empowerment about their lives and about how they manage their resources. So I think working in an integrated way creates so many synergies that we are now reaping the rewards of. Working in an integrated way also means that we have a variety of entry points, so we can engage communities on a variety of different subjects at different levels to get buy-in for the work that we do. And because they value the work that we do, they value our health and education work, we get buy-in for our conservation work because they trust us as an organisation. So, you know, we couldn't be more excited about what integration does for us and offers the community that we work with. So far, so good, huh? Now, on the 22nd and 23rd of February, sorry, this is very emotional for me, but that happened in Madagascar. So this was Cyclone Haruna. It's the worst cyclone to hit our area of Madagascar in 35 years. And huge loss of life. People were lost their homes. Thousands of people without shelter. Tens of thousands without water. And we were the only functioning organisation in the region. So we thought, well, blimey, we better help. So what do? So we used our network of community-based distributors to gather information about what was happening in those regions. What's the nature and extent of the damage that's happened? What do you guys need in the field? So we used our community-based distributors, we used all of our contacts within the community to gather information as best we could. Okay. We then used all of our networks in country and internationally to communicate what had happened. So all the people who were interested in providing aid, who were interested in what was going on, we could coordinate efforts, we could disseminate that information, and we were the advocates for the community. We were the mouthpiece for the community saying, guys, this has happened, this is huge, we want you to know about it, we need your help, because we were well placed to do that. Okay? And because of our infrastructure in the ground, because of our good relationships with the community, we were able to procure and disseminate supplies that the communities needed, mosquito nets, water purification systems, and diarrhea treatments. There was a diarrhea epidemic overnight. 1/3 of the population developed diarrhea overnight. If you imagine a community that has open defecation, and then all the rainwater washes off into these open wells, you can imagine what happened. So that's a picture of one of our wells. That was one of the ones that wasn't completely flooded, but that's normally all dry, but you could see the rainwater had come up to nearly flooding the well completely. Now, we weren't expecting to ever have to do this, but what we realized was because we worked holistically in an integrated way, actually, we were quite well placed to do this. Our good relationships with the community, our good links and networks with the community, our network of community-based distributors and everybody else, meant that we could respond quickly, we could gather information, we had the trust of the community to respond in a way that they wanted. We knew the community well enough to know how best to respond, what the needs were. And we had the distribution and supply chains already in place to better procure greater supplies and get them out to where they were needed as quickly as possible. And what that meant was that by the time the first aid organisation arrived just to collect information, we distributed aid to 17 villages already. What it taught us is that we were able to move from development to aid because of our capacity to do WASH, our capacity to engage with the communities, and our capacity of 33 community health workers in the field. Having a disaster to deal with ended up reinforcing our existing development work. It reinforced the importance to us of doing WASH. We suddenly realized how important it was that we had capacity to tackle water work. It reinforced that. And because we had to take on this additional work, we trained our community-based distributors in doing this stuff more effectively. So it's provided reinforcement of our work, and it's generated greater momentum for that work that we need to continue as we go forward. You know, these were completely unintended consequences of working in such a holistic way. And I suspect, you know, we live in a changing world, and I suspect having that ability to respond and having the capacity to respond to what communities need is going to you know, stand in our favour. So my own feeling is that not only does working holistically and working in an integrated way offer huge amounts of benefits in terms of enabling us to achieve our conservation and health goals more effectively, not only does it lead to cost efficiencies, not only does it lead to greater buy-in, actually we're building capacity and ability to adapt to situations as communities experience them. Thank you very much.
What did I tell you? I have the advantage of sitting up here and watch, and I can watch you watch him, and everyone's quite rapt and paying very close attention, Vic. There were three things that you said that really struck me. The first was, excuse me, when women hear family planning, they hear fisheries. And when men hear fisheries, perhaps they're hearing contraception for the first time. And I liked that you framed the first part of your presentation around this model of here's this cycle with sobering data and information and a model that's in place that's not working. You come in on community engagement and needs. You work closely with the community. You're delivering services. There's an education component and then the scaling up. So that's encaptured for me in that first statement. The second statement that you made, and for me, was when you presented the data, this new data and evidence of what has happened, but then you talked about what I see is they're happier, what I feel is they're healthier, what I believe is that they're more empowered. And this, how do we tell the stories around this? How do we share the data, and what's the quantitative side, but also the qualitative side, and how do we capture that and talk more about that in a real and meaningful way? And the third thing that you said, which I always love having you say these things, you know, blimey, we better help once the cyclone hit. And sort of looking at these components of resilience and really what are the key critical elements of resilience: information, networks, advocacy, infrastructure in place, communications in place, being able to move very quickly. So thank you very much for that wonderful presentation, a great framing of issues, and a wonderful transition to our third speaker, Kim Westerman, who is also going to be talking talking about some of these elements of resilience. Kim is Conservation International's advisor for gender and conservation, and it just so happens that she has a history of working with Vic and his colleagues at Blue Ventures, because she previously worked there as the conservation manager for more than 2 years, helping to support their marine management and collaborating on their integrated programs. Kim has led research initiatives and published on a number of issues that we're talking about today around resilience, climate change, connections, adapting to sociocultural influences, and what tools can be useful. And I have worked in organizations where Kim's work has continued after her departure. And I could say, having looked at some of the work that she has done previously, that she has an excellent analytical mind. And I know, based on her time in Madagascar and overseas, that is now informed by very concrete and strong field experience. And we were just chatting about this, you know, in her role now at Conservation International, she's able to bring all of that together. So Kim, with that introduction, we'd love to have you come up and chat with us.
Well, thank you, Roger Mark. As he just explained, I am working for Conservation International, but my presentation will be almost wholly based on my over 2 years in Southwest Madagascar in the Velindrica LMMA that Vic just greatly explained to you. So I'm going to try to pull together those last two conversations and pull them together around resilience and women. Now, I just came from the International Congress for Conservation Biology up in Baltimore over this last week. And not surprisingly, there was a lot of talk about ecological vulnerability and climate change, you know, predictions about wildlife and landscape changes, and discussions of grand and complex mitigation schemes, and disturbing stories about ecosystems that aren't adapting fast enough. And I was also actually really heartened to find that there was a lot of discussion about social issues in climate change and in conservation. Because, you know, climate change is really a cross-cutting issue. Vulnerability is a really a cross-cutting issue, but too often we're siloed. You know, we in DC are always talking about being in silos. So we need to be thinking about social vulnerability and ecological vulnerability and how we can be building resilience in both of those. So kind of starting off at this high-level planning policy, we've got a lot of different mechanisms or things that we're doing. You know, we've got the COPs every year, bringing people together, having these very high-level discussions about climate change. We have, you know, regional strategies and action plans. This one's from the Western Indian Ocean on climate change and in the marine area. And then we've got the, you know, national level action plans. Now, these are great, and they're starting to bring in more social dimensions, poverty, gender, issues like that. But, you know, there really isn't much implementation on the ground yet, especially in areas like where Vic and I work. This high-level planning still is very vague and indeterminate, and most people just aren't really being affected by any of it yet. So what I think is so great about Blue Ventures and what Vic was just talking about is this ecological and social integration, and how that builds pragmatic and very tangible positive impacts for the communities, and really builds up their resilience socially and ecologically. Now, Vic mentioned Cyclone Haruna and the disaster assistance around that, and kind of the resilience that the communities had and that Blue Ventures was able to tap into because of the integrated approach. But I'm going to get a little bit further into that. So thinking about the ecological side of things, you know, it's a locally managed marine area. In the entire area, there are restrictions on destructive fishing practices. And so there's a lot of education around that and things. And that's really that, along with these no-take zone areas where there's no fishing allowed inside. Those are reducing anthropogenic pressure on the reef, on the marine resources, so that they're better able to withstand climate change impacts. So we've been able to see a pretty significant decrease in beach seining. This is one of the destructive fishing practices that was identified. We've also seen that the no-take zones are being used by our target species, our target fish species. It's still a little too early to determine biomass or abundance or anything like that, but it does look like they're using it, that it's ecologically healthy. So getting to the social resilience, Vic was mentioning the health, the diversified livelihoods, and the education pieces. And those kind of build up the social resilience. But I want to focus a bit more on the octopus, because the octopus really is the genesis of the Vellandriaca almamae and continues to be really the main ecological management tool there. And I'm going to focus particularly on women and resilience around the octopus fishery, because ensuring that women and men are equally benefiting from natural resource management and livelihood initiatives is fundamental to conservation and development, is fundamental to long-term sustainability, and is fundamental to social and ecological resilience. And I think the Vellandriaca almamae is a really interesting case study in which to kind of think about resilience in women because of these octopus closures. So just to give you a little bit of background about octopus in southwest Madagascar, women are the primary harvesters of octopus. They go out on the reef flat during low tides. That happens about twice a month. They'll walk out on the reef flat, so it has to be quite low for them. And they're able to stay out for, maybe 2 to 4 hours, depending on the tide that day, and maybe for 3 or 4 days every 2 weeks. So they're pretty tide dependent. They don't have that much time out there. Men in this area prefer to go regular fishing. They have their canoes, they have their sailboats, they'll go out and fish for the day. But there are some men that do enter the octopus fishery. And when they do that, they're a little bit less restricted. So they have their boats, they have their sailboats, so they can go out farther. They also will take a mask with them, like this guy has, and maybe some fins, so they're able to dive deeper down and harvest octopus that are quite farther down, and we find that they're actually a bit bigger. I'll get to that later. So the men are, because they're swimming, because they're not restricted by being able to walk out on the reef flat, they have a much larger time that they're able to spend out there. So just to give you a little bit of historical background on the octopus fishery, because I think this is really important. In the early 2000s, a regional exporter based in the largest town in the Southwest, who has been a very strong promoter of these short-term octopus closures that I'll talk about in a moment. This exporter finally made it up to this remote area. He has these big trucks that go up that take 24 hours to get up there, and he has boats, and he finally figured out a way to get enough ice up there to be able to put the octopus on ice. And so all of a sudden what happened, not surprisingly, is this fishery, this octopus fishery, turned from one of subsistence fishing, so whatever people could eat that day or the next day, into a market economy. And obviously this has pretty big socioeconomic repercussions in the village, and quickly people saw a decrease in octopus. All of a sudden they could harvest as much as they wanted, and they were making money off of it. And so it was about this time in the early 2000s, 2004, 2003, 2004, that Blue Ventures arrived in the area. And we started to hear these stories about how there used to be, not long ago, there were tons of octopus, and now there's not as much anymore. And so we started talking with the communities about it. And one of the solutions that we came up with was to pilot a short-term octopus closure. So in 2004, the village of Andavadoka, which is the main village in the LMMA, closed off a portion of this sandy island off the coast. They closed it for 7 months, and this was the first pilot closure. After the 7 months, it was opened, and about 1,000 people swarmed to this place. Everyone had kind of heard what was going on. They thought it was really interesting. They wanted to see what was going to happen, and if what we said was going to happen actually happened. So catch per unit effort, catch per person was actually quite low because there were so many people there, but it was actually, the total catch was quite high, and so it was quite successful. And this was the first time that people really thought, this is what happens when you close off an area to harvest for a little while and allow allow it to grow. So the next year, 2 more neighboring villages decided to try it. So we had 3 that year. The next year, a few more. The next year, a few more, and it started to proliferate. And as of now, most villages, all the villages that are right on the coast that actually have this nice reef flat where they're able to go out and harvest, they do these closures every year. So as of 2013, we've had a total of 85 in Velandrieka. And during this time, between 2004 and 2011, Blue Ventures worked with local data collectors on these beaches as people were bringing their octopus harvest in. And we collected data. We have over 35,000 fisher trips and over 117,000 single octopus data points. And we, aside from just collecting, biophysical data about the octopus, how big it was and stuff, and the sex, we also collected social data. So we found out, the gender of the fisher, how they were fishing, and where they were going. Let's see. So, as these octopus fisheries were kind of getting going, there needed to be some sort of management or governance structure set up, and so. They formed what's called the association, the Velandrieka Association. It's formed of elected leaders from these 25 villages. And they come together twice a year as the big group, and every month as of these 80, a smaller elected group comes together, the executive leaders. And they're really the ones that make the decisions about when to close, where to close, and other management decisions within the locally managed marine area. Now, we often talk about population health environment as being a really good way to get women involved in natural resource management. As we were talking about, when women get together for a health discussion, they get environmental messages. And while that's true, the very robust PhD program at Blue Ventures, even given that, we haven't seen very many women enter into the association. So this year, 2013, there are 80 members, and of those, 13 are women. And there are 0 that are elected to the executive leader level. Now, this isn't that surprising. In Madagascar, as in many other developing countries, women are really busy. They're responsible for cooking, fuelwood harvest, water harvest, taking care of children, and time is really very precious. There's also cultural barriers that keep women from seeking leadership positions or speaking out in public. And the few women that are in the association, they'll almost always sit in the back. Often they'll bring a nursing child with them, and they very, very rarely speak up or add to any of the discussion. But for conservation projects like the LMMA to be successful, women must be more empowered and engaged in management so that their unique needs, priorities, and concerns are being addressed. And this is especially true with the octopus fishery because they're the primary harvesters and therefore highly impacted by these management decisions, yet they're not at the table. So we started to ask questions. Where are the women? What barriers are they facing in joining the association? And how are they being impacted by the current management? So we had our natural resource management officer and our health officer get together. And they held a series of workshops throughout 10 villages in the LMMA, and they discussed these issues. And then we had a half day with men and a half day with women. They were separated so that they felt like they could share their stories. They both got natural resource management messages as well as health messages. We had a total of 129 men and 139 women attend, so we got a pretty good turnout. At the same time, we looked at that octopus data I was talking about before. And we found that about 86% of women, adult women, are hunting octopus, or getting octopus. And about 31% of men are doing the same. We also found that of the octopus that's caught, 99% is sold. So clearly octopus is a really important commodity in this area and allows women access to cash. Those octopus, as I explained, are sold to that exporter who's set up on the beach. And this is the first time, really the only way that women are able to get access to money. Aside from, maybe having a business in town, which very, very few people do, this is it. And while there's some debate in the literature about women and money, the general discourse is that women are more likely to spend their money on household items, education, food, clothing, than men do. So this is really important. Now, coincidentally, these octopus closures usually happen in the austral winter. So they're from May, June until August or September, which is right around the time when school starts and people need to pay school fees. So what we'd like to see is that people are using this kind of as a banking system where, as the school season or the school year opens, they all of a sudden have access to all this cash and they're able to pay the school fees. We haven't actually been able to show this yet, but it is an area for future research that I think is really important to actually see how men and women are using that money differently. So getting to some of our data results. So it's pretty interesting. So the weight per unit effort is substantially larger for men. And that's not all that surprising. I told you before that they're going deeper into the reef where larger octopus tend to be. The average weight then, of course, men is higher than women. But the number that each are harvesting is not quite the same. Women are catching more octopus in number, although unfortunately this is not statistically significant, but it's definitely a trend that we're seeing. Within that time frame that we collected that data from 2004 to 2011, there were 20 octopus closures, and of those, 16 were dominated by women. I believe 3 were dominated by men, and 1 was about equal. So individually, women bring in 18% less money than men do. Again, this is because men are catching larger octopus. But as a whole, women are dominating dominating the harvest and making more money simply because there's more of them out there on the reef. And interestingly enough, too, the catch for women reduced by about 12% when the opening day was, when the tide during opening day was equal to or higher than 1 meter. So again, getting back to the fact that women are walking out on the reef. So if it's not being opened, if the opening day isn't on the very, very lowest time and day of that month, it's going to affect women more. And we also found that over 50%, just over 50% of the closures were actually opening at or above 1 meter. Getting to those workshops, they were incredibly successful. Both men and women were very interested in the subject, and by and large, very saying that women should be encouraged and empowered to participate more in the association. They were also very good at getting out this reproductive health message to men, which Vic mentioned before, and dispelling a lot of myths about family planning. And the workshops really reflected a lot of what we saw in this data. So the day and time are not necessarily coordinated with women's needs. Men selectively enter the fishery at opening. So I told you that most men prefer to fish regular fish, but on opening day, when it's kind of a celebration for the village, and the men are much more likely to hunt octopus that day. And that, there's some women that weren't very happy about that. So some of the solutions that came out of the workshop, the first one was these separate meetings. Almost everyone in all those workshops said that women wanted to have their own meeting by themselves to come up with their own ideas, and then that one person would present that to the association or to their village. Another solution that we kind of proposed, just kind of standing back and looking at the situation, was pick meeting times that work for women. So don't have a meeting when it's low tide, the lowest tide of the month, for example, or hold meetings in the evenings when maybe women have more time. Another one is hold meetings closer to villages. So right now, most of the association meetings are held in that central village, and that it makes sense. That's the biggest village in the area. It's centrally located. It's where the president lives. It's where Blue Ventures is located. But it's incredibly difficult for women to leave their families for a day or two, travel for 8 hours by foot, have to find somewhere to sleep that night, and leave their families. So if we could actually take some of those meetings out into the villages a little bit more, the more rural villages, that could help. Now, these are all very nice in theory, but they're incredibly challenging to implement. And I am pleased to say that first solution we did see happen just following these workshops. The next association meeting, the women were put by themselves and they were allowed to speak. They did have a male secretary take their notes, though, for them, but needless to say, we saw, at least a small step forward. And Blue Ventures has recently received a grant from DFID in the UK to work specifically with women around octopus fisheries in the southwest coast. So there is a lot of effort behind that now. So in closing, I want to just kind of think about how we're always thinking, we always say that community-based natural resource management and community forums, village meeting forums, are the best way to get at community needs and desires, but those often perpetuate these cultural norms of disempowering women and not allowing them to speak. And so I think that we conservation managers really need to be aware of that, and we need to push the envelope and find these creative solutions and ask the right questions. We can't just fall in the old adage that it's the culture and women don't want to be involved. They do want to be involved, and there are ways around it. And I was incredibly happily surprised to see that the men and women across the board they said, yeah, of course women should have a bigger say in this. Of course they should. They just hadn't gotten to the point of actually implementing it. And then, of course, linking back to climate change resilience, if women aren't at the table, we're missing half of the environmental stewards in the world, and so this is very important. And this just chronicles one small example of what I think will be a long process, but I hope that it does continue and that incorporating women into natural resource management in Valandrica and around the world continues and evolves. We actually have a paper coming out about this data and these workshops, so please look for it. I want to thank my co-author, Sophie, who did all the great data analysis, and I want to thank Matthew Erdman for helping put together the workshops, and of course Blue Ventures and the people of Valandrica for supporting all of this. So thank you.
Thank you very much, Kim. It's really good to hear a perspective from a conservation manager and to sort of walk us through the critical question of where are the women? And I really like that you sort of did that. A lot of what I was hearing you talk about in your lead up before you presented the results was questions of scale. So do we look at this from an analytical perspective in terms of an ecological scale or social scale, and then you sort of took that to an operational scale. What does it mean internationally, regionally, nationally, and at the local level, and really making the case for looking at these issues and impacts at communities at that level. And the question of scale, again, coming up with the impact, moving from subsistence to the market economy and what it meant for that community, and then scaling up the replication that you were seeing happening, and then sort of bringing in the questions of scale and governance and livelihoods and sort of what that meant and the challenges involved moving forward. So I think just a wonderful perspective and overview of building and encapsulating what we've heard with the other presentations. So thank you very much. Now it's your turn. We're going to open it up to you to hear your comments and questions. And just a reminder that this is being webcast live. So we'd ask you, as my colleagues come to you with the microphone, to please introduce yourselves and give your affiliation, and keep your questions and comments fairly short. We have a good amount of time, but we'd like to get as many of them as we can. So, questions, comments, reactions? Yes, please. If you can speak into the mic and your name and affiliation.
Okay, thank you. My name is Eve Ferguson from the Library of Congress African section. And Kim said that men said, oh, great, it's wonderful, to empower women. But my question to all three of our panelists would be, once you empower women, you're also changing the traditions and changing the culture to a certain extent. Were men totally embracing the fact that women are now making decisions about what happens in their lives, whether or not they have children, how many children they have? Because in a lot of these societies, they are very patrilineal, and men usually make those decisions. So what type of feedback, if all three of you could speak to what type of feedback you got from the men in embracing these new powers that women have to make decisions for themselves?
So where were the men? Were they really on board? I do.
Okay. We were very fortunate in that with our health initiative, the men were very supportive of our work. When it came to engaging men on the issue of reproductive health, sometimes we used different messages. So the messages might have been around, well, your women will be healthier if they use family planning, your children will be healthier if you use family planning, and if you plan your family, you may better be able to provide for them. It'll be less of a stress for you as a fisher to provide for your family. And so by changing the messages slightly, we were able to engage men quite effectively. Having said that, in the community, it seems very much as if the man has the final say into how many children that they have. So when a woman comes for contraception, she will, almost always come with her husband's blessing. But even if she's had 10 children, she will say, I'm spacing my family, because it's her husband's decision as to when to stop having children. So we see some of that still being played out, but we haven't really experienced any tension or conflict around that. And because we had such good relationships with the community already, for a variety of reasons, they were engaged from the very beginning.
Well, yeah, I guess like I said, the men, by and large, they realize that that the octopus fishery is dominated by women, and I don't think that they think of conservation or of the the management of the area as a man's role necessarily. I think they're open to it. They just saw that women are usually too busy to be a part of it, or they didn't prioritize it, or they didn't weren't interested in it. So they were certainly open to the idea of if a woman wanted to be a part of it. And I mentioned real quickly that these are elected by their community, these delegates basically, and so they have to get some sort of support from their community to be the delegates. And it depends on the size of the village how many you have, but so you need someone that's going to be a leader anyway, a woman that is going to put her name forward at least.
If I get your question right, the question is, are you saying that, are you asking what is the reaction of the man when the woman takes control over her life?
Mm-hmm.
Is that what you're asking?
Generally.
Generally.
Or what is the response that men have? Because I know also in the Gambia is a predominantly Muslim country, and does that come into play in more or less giving women license to make these decisions, which might have traditionally been made by men?
Okay. In this case of this group of women, or women in general in the Gambia, this particular woman, the men are there. The women take care of the family. They go from sunset down to sunset, fetching for their family. Now, when they have children, they take care of the children. The men are polygamous by nature. They go and get as many wives as possible. Now, it is the woman who takes care of her health. So her decision, it's her decision, it's her body. So that's what we train them to do. But then the men they don't really, when you tell a man, we're going to the hospital, we want to go with you to the hospital for you to give the consent, which doctors do, we don't know why, to give the consent for a woman to have her tube tied, they don't normally like to go. But these days, doctors they take decisions. They allow the woman to take their decisions because it's their lives, and they are the ones who take charge of their life. They take care of the children. So in our case, it's not very. It used to be before, but not anymore. I think men are happy for the women taking over their lives by themselves and making decisions for themselves. So I mean, it's not to do with Muslim or Christian. It's nothing. And these particular women I'm dealing with, they are all Christians, as a matter of fact. And they go to labor, like that lady I showed to you. At the age of 29, she's got already 6 children. 6 children. And she has to go looking for food for the woman, for the children. The husband, they are mostly, they don't have jobs per se. They are mostly bricklayers or night watchmen. So they just provide what they can provide. The women are the ones that will do the rest. So even if they have any say, I don't want to talk about that.
There you go.
Thank you.
Now you're really answering the question.
I don't want to talk about that because, I mean, it makes no difference.
Forge ahead. Okay. We have a question in the back with Jason, and then up front.
Hi, I'm Jason Bremner from Population Reference Bureau. Thanks for your presentations. Roger, Mark, if you'll allow me 2 separate questions. The first is that delivering the type of healthcare services, Vic, that you talk about to these remote areas, while you talked about it being cost effective and that you can share the expenses of delivering health and conservation services, still seems expensive. I mean, you've got to get services and commodities. We call them commodities. It's just, methods, reproductive health methods, a long way out there. So do your donors and people you're trying to convince, do they accept the cost per user of this approach, given the expense? And do they question that? That's the first question. Totally unrelated question. Second question that came is, have you thought about the or are you measuring the family planning and health components' impact on resilience? I've never really seen anybody who's kind of measuring whether or not family planning or access to it or not having access to it affects vulnerability, adaptive capacity, and resilience. Thanks.
So thank you for your question, Jason. So we personally have analysed our costs in terms of costs per beneficiary, and we've also sought feedback on that for our health component, and we feel actually we offer good value for money even with all of the costs included for our health program. We've had feedback from DFID, for example, saying that actually in terms of cost per beneficiary, this represents good value for money. Firstly. Second thing to say is that we are moving increasingly towards a community-based distributor model for service delivery. And as time goes on, we're going to pull back from offering traditional clinics, and we're going to empower the community-based distributors to offer as many of the services as possible. And we're going to take, as time goes on, as light a touch as we can to managing and supporting our community-based distributors in providing those services. And we've got a variety of models in mind as to how we're going to do that. What we're currently testing, really, is how far back can we pull. How cheap can we make this service whilst maintaining the quality and safety of service provision? I'm confident my personal exit strategy is that we will have probably one half-time manager managing all of our community health work, including our education, and a team of really skilled, empowered community-based distributors doing the majority of our health work. And that'll be a fraction of the current cost of our program.
And in answer to the question about family planning leading to climate change resilience, that's a great question. We haven't looked at that yet. I think there's a lot of different avenues we can take in kind of pulling out some more interesting studies from this data and from these workshops, and that would definitely be one of them. I have no idea if in the literature there's, it's intuitive that healthier people are going to be better stewards of the environment, and therefore you're going to get climate change resilience, ecological climate change resilience, but I'm not sure if that's ever been tested or anything.
Can I come in on that one, actually? Is that okay? So the National Adaptation Programs of Action that were written by 40 of the poorest countries in the world. So the 40 poorest countries in the world, I think it was that many, were asked to present a program of action that they needed to take now to adapt to climate change that they're already experiencing. And presenting that plan would hopefully attract funding to address those immediate issues. And of those 40 programs, 37 of those programs cited rapid population growth as undermining their country's ability to adapt to climate change.
But is anything being done?
Well, interestingly, none of those 37 countries included family planning as a means of addressing some of these issues these countries faced.
Thank you. We have a question up front.
Thank you. My name is Ariana Rabindranath. I'm with George Washington University. I'm wondering how your programs interact with national governments, national policy. Are good policies in place, but implementation is not? What kind of policies would you like to see or change? Thank you.
Well, just today, a report came out by the World Bank that that said that Madagascar is on its way to becoming a failed state. There's been a coup for the last 4 years, and it doesn't seem like anything's on the horizon. Keep talking about elections. And you know, where we work is just so remote that the government is not there. There's a couple crumbling hospitals that are rarely staffed, and if they are, they don't have supplies. I guess in terms of the conservation side, there's, you know, the fisheries management in Madagascar. They have something like 5 boats for the entire island, so they're not there. Vic can maybe talk to the health side of things.
Yes, so on paper and officially, they're fully supportive of our work. And officially, we partner with them for various things, but because they're facing so many challenges at a national level, they're unable to deliver any part of their side of the bargain, really. So we do it the best we can with what little support we have, and this is the reason why we take a community-based approach to our work. We're trying to build capacity at a community level so they can look after themselves as much as they can.
Well, as I have said, we are the Gambia government, for the first time in Africa, has given us the exclusive right to take to manage the Tanbi, which is a Ramsar area. It's a national protected park. That is a major achievement, and it's a living document. That is when we got the co-management plan together with the ministries involved, the Department of Fisheries, Department of Parks and Wildlife, and Department of Forestry. So we have full support of our government, and it's about to be gazetted. So that means we have exclusive right, and I think that's a great achievement, and I think we're happy with that. In future, I'm sure many more things will come up, but right now we have encouragement from our government. And then here we have, okay, this is from our embassy. They are here to support us, and they're all aware of what is happening. And we normally do we normally do have fundraising events, and everybody attends and they support us. And even our president did support us, and we are now looking for land so that we can have our own center where we can own and do our programs. So we have support from our government as at now. Okay.
Thank you very much. Is there anything you would like to add from your perspective, sort of representing the government here?
My name is Boubacar Diallo from the Embassy of the Gambia in Washington, D.C. here, and I'm with my colleague, Mrs. Fatoumata Sidibe, who is the cultural attaché. I would first like to thank the organizers of this discussion here for the invitation that was extended to us at the embassy. And also I would like to thank the members of the panel for their presentation. Well done. I just want to add on the issue of women empowerment in the Gambia. And I think my sister from the Gambia has said it. Women are being empowered in the Gambia. That doesn't mean there is a revolution by the women. They work hand in glove with their husbands, with their brothers and uncles. And I think we have come to a point where we need to clarify certain issues, even in religion. Women in Islam, the woman has been given a prominent place in Islam. It's only that in nature, man has always been dominant on women. And I think gradually women are getting their places, right places in society. And in the Gambia, it has been demonstrated that the woman is the other half of our lives. Even in the setup in government, women are prominent in high places. The vice president is a woman. The education minister is a woman. We used to have health minister as a woman. We have the energy minister is a woman. We have environment, fisheries, whatever is a woman. We are having all this. I mean, it's been demonstrated in the Gambia that we cannot do away with women. Because we cannot, even though we are dominant, but we have to make sure that they also have a say in how they lead their lives. Not that they revolt and say, we are independent now, this is how we want our lives to be. No. Through education, sensitization, communication, all these things are now coming in the forefront for discussion around the world. And I think in Gambia, the president gives the women, top priority over men. And he said the men are lazy.
Yeah.
Well, I'm not saying it because I want to say it, but he has said it. Somebody here
Says it's a fact.
It's a fact.
Yeah. That's a I don't think that's a yeah, because I am a responsible man. I have a wife. I have kids. I take care of my kids, not my wife. So it's an equal sharing thing. The other thing that I wanted to find out from Fatu and the rest of the panelists, I had how the integrated aspect of women's activities in fishing, like with the oyster, the shrimps, and other marine life. But with the revenue generation, I don't know how it is done. Whether you have markets, like the supply aspect of it. Do you have markets outside? Like in Madagascar, do you have markets outside Madagascar? Gambia, do you have markets for the oyster? And also, after harvest, how do you ensure the health aspect of conserving, keeping the oyster so that you don't have these things becoming poisonous at the end, because like in the United States, they're very strict. They are very strict on food importation, so the inspection aspect of it and all whatnot, and that type of thing with AGOA, this African Growth Opportunity Act by the American lawmakers. Are you taking advantage of that so that you have economics of scale instead of individuals, going to do the harvesting and selling it individually? Do they come together so that you have better revenue? I think I will stop at that. Thank you very much.
Thank you very much. So questions around scale, how do you take it to scale, revenue generation, and sort of public health standards?
Okay, in our own case, in the Gambia, the oysters, we haven't got the water certification yet to export oysters outside to the EU and to the Europe, to the Americas. So we are working on the water quality research, and for the past 2 years, there has been data collection going on. In fact, it is being supported by the University of Rhode Island in Providence, and then the water is clear, is very clear, but we do not have the certification yet. It would take us a long time. We want to go on for a long while. It is clear that the water is very clean. It's cleaner than the water in Providence, if you don't know. But we have to have the capacity. We haven't got it yet. It's a lot of money to be able to get that certification. It costs like over 50,000 euros. So we don't think we are quite ready yet for that, because as you know, you come from the Gambia, you have seen that oysters are being sold on the main road. Now we have to have a proper processing plant where our aim is to get Guinea-Bissau, Sierra Leone, Senegal, to have a processing center where all oysters can be bought there and to be packaged and to be exported. But we do not have that as yet, but we are working on it because that's our wish. That's what we're really working towards for. And then as it is now, what we do is we organize the women. They work in cooperative. They are now together. We have a membership of 500 women. And we bring in oysters together, and people who want to export in containers, they do come, and we organize that. And UNDP has given us a vacuum packing machine, which we see in oysters. If you come back to the Gambia, you'll be seeing oysters in the supermarket, in the supermarkets, and also in the restaurants. So we are working towards that, but it will take us time to get there. But that is in the next 5 years, we hope we will get to that stage. But as of now, we are okay. Okay. But does that answer your question? Yeah.
So in Madagascar, the reason that these octopus closures work is this partnership with the exporter. So as soon as the woman or the man with their octopus sells it to the middleman who's sitting on the beach with a block of ice, it's in their hands. The processing and the exportation of it is. Now, interestingly, about 2 years ago, and so most of that octopus ends up going to the Mediterranean countries. So there's a lot of standards and things like that. About 2 years ago, they did a test, and the octopus in the Mediterranean that came from this region tested positive for E. coli. And this is not that big of a surprise. There's open defecation on the beach, which is where people are dragging their octopus and their squid as they're going up to sell it. So there was a big concern about that, and I'm not quite sure what happened, but they were able to clean it up, and it hasn't been an issue since then. But that would be devastating to the local economy, and really, I think, nicely ties in the whole idea of water sanitation and hygiene, and the need to be thinking about that for long-term sustainability of these closures.
I think you had your hand up? Yes, go ahead. Sorry, go
If I
ahead.
may add just one thing to this question, the answers. That if you look outside, we have the fact sheets there. We have oysters. We have a co-management plan. As I said, we work together with these ministries, with the departments of fisheries and all these people. And what we do is we have a closure season for the oysters. Oysters before harvested from January all the way to July. Now the women have come together and say, okay, we want to harvest oysters 4 months of the year. The rest of the year, nobody harvests oysters. And that has been very useful for them, because we have seen the oysters have grown bigger and the women earn more income. And then during the rainy season, as we have said, oysters are filter feeders. They go, the water comes along, and then the oysters will just open their mouth and catch anything that passes. So because of that, rainy season, oysters are not eaten. I mean, there are many reasons why oysters are not eaten. That is the we think scientifically that's the reason. But it could also be that the women did that so that the people will rest the oysters. They don't harvest the oysters during the rainy season. Other time, the saline content in the water is very low, and oysters are tasteless. So these are all the reasons why we say that oysters cannot be eaten. And with the 4-month season, we have seen the difference, and the women have really seen their income being increased from that 4 months. That is why after the 4 months, we have alternative livelihoods for them. We teach them to do other kinds of businesses. We give them microfinance so that they can earn a living during those period of time. So that was just to add to.
Thank you. I think we had a question at the back.
Hi, my name is Monique St. Jar. I'm from the Child Labor Coalition. Thank you for your presentations. I'm just wondering, child labor is clearly an issue that affects every country in the world. I'm wondering if you came across any issues of child labor in the oyster or octopus industry, and if so, how did you involve that in your approach for a holistic community development?
With us, the oysters, what we've done with the women is that we have forbidden any young woman, any young girl selling oysters out in the street. It is, in fact, it is accepted, and nobody does that. But again, before school, before they go to school, some children go to school in the afternoon, others go in the evening. They help their mothers just to shuck the oysters and I think that's okay. So, but otherwise, we don't have any problem like that with children and doing business, helping their folks.
So you probably saw my last slide was children harvesting octopus. A lot of children don't go to school, and they end up going out with their mothers to harvest octopus. And really, aside from, Blue Ventures does have a very strong education program. We have scholarships for formal education for primary and secondary school. We also do informal education on Saturdays specifically for children out of school as well as in school. So aside from that, though, we don't really address the child labor issue.
Yes, we have one question in the back.
Good afternoon. My name is Donnell Stewart, and I work as a consultant and grant writer on behavioral health issues and maternal and child health issues as well. And I have a question about, maybe you could just elaborate on some of the traditional indigenous family planning practices that you came upon, and how you're marrying some of that with Western medicine. I'd also like to know about contraception for men and vasectomy in particular, if it's ever been broached, and if you run into some of the same things I do here on the East Coast when raising that issue. And lastly, perhaps it's just the season I'm in, but I'm finding myself more and more fascinated with traditional and indigenous approaches to menopausal symptomology. So if you can talk about that, and again, how you've managed to bridge some of that with your Western medicine approaches, that would be great.
So I'm guessing this is the question for the doctor, right? Okay.
Except I'm always interested in hearing what women say about
Okay. So people don't tell the doctor everything, do they? Okay. Well, so I'll share with you what they've told the doctor. And so in terms of traditional methods for contraception, our understanding of it is that women don't use very many traditional methods of contraception. What they will use is increasingly desperate methods of inducing an abortion once they find out they're pregnant. And this is something that frightens us when we hear the stories and we talk about, but obviously we don't engage in that service. So this is something we hear about. When it comes to contraception, we're not aware of them using any traditional methods particularly. What we did come across at the beginning of offering these services was a huge amount of fear around contraception, mainly to do with misinformation, misunderstanding of the risks and benefits of modern contraceptive methods. So a lot of our work at the beginning was education, was dispelling some of those myths. That was the first bit, wasn't it? Vasectomy. So I'm glad you asked that. We offer the full method mix of short-acting, long-acting, and permanent contraception for couples. So we offer condoms. We offer 2 types of oral contraceptive pill. We offer cycle beads for women who don't want to use any hormonal methods. We offer the injection. We offer the implant. We offer the intrauterine contraceptive device. And we offer permanent methods, vasectomy for men, tubal ligation for women. We offer the whole method mix, but to date, no one's taken up permanent methods, men or women. Was that everything? Was there anything else? Oh, the menopause. I'm sorry, I've not got a clue about that one. I'll be honest with you. We've really focused on what the community presented to us were their most pressing questions and needs around health, and we focused on the low-hanging fruit because we're stretched as a resource as a resource.
Vasectomy? Did you say talk about vasectomy in men in Africa? That does not exist. I'm sorry, it just doesn't exist. Yeah, it does not exist. I've never come across any man who has even heard about it. If they do, they will never do that. Because men can get, if I'm wrong, correct me, as many as 4 wives, and they can divorce and get more and go and more. So long as they have money to marry wives, they can marry and get as many children as they can, as many children as they can. So that does not. We don't talk about that. We don't intend talking about that. Yeah. And for menopausal problems, as I said, even the educated women in my country so a lot of people don't know about menopause. It's a fact. People don't just go out to look, to read, to understand. And unfortunately, the doctors that we have at home, they're mostly men. As he has said, they don't have much ideas about what menopause is all about and what the woman body goes through and what they can do. So I've this particular case of this woman. I just was telling this story. She was suffering from menopausal problems, and she, suffers from all this heat, and she thought it was some spiritual something going on in her life. And she comes to the office and says, Fatu, this is what's happening to me. Somebody has done something to me. So we listen to her, and then we explain to her what is happening. And when she went to the doctor, the nurse looked at her, okay, whether she didn't know or she just looked at her and said, look, you have to have a husband. You need a husband. For her, that was the answer to that. And a lot of times, doctors do not prescribe HRTs for women because they don't believe in HRT. They believe there are many other problems, but they don't go. They are not with the woman. They are not women, so they don't know what happens to her. But they do have the women. They do have their traditional medicine, like they have these herbs. They say you have it's a tangor. That is, there is heat, some kind of disease of heat. So they give there's some herbs that you are given to drink every day, and they ask you to go and walk on the water with barefooted and there's cold water that will help. So these women practice all these things, but it's very, very difficult for them to understand what happens in their body. And then the other question was. What was the other question? The menopause and then the
traditional methods.
vasectomy, and what else did you want to know?
Traditional methods.
Traditional birth control. You know, when I was in school, we actually are given something to wear that stops us from getting pregnant. I can say this now, but the mothers, sex is something that we don't talk about. Mothers don't talk about with children. So when you go to school, go to college, they give you something to tie around your waist. They say, just make sure you tie this. Never take it out. So I asked this question to my mother, what is it for? He said, just wear it and don't ask questions. So in the end, I said, okay, so long as you wear it, you have this, you will not get pregnant. So this is what we use. And I believe a lot of people are using it now, but it doesn't work all the time. It fails sometimes. And then when it fails, you get pregnant. But then the women, what they do is when they go to family planning, they give it injections. They have reactions. Some of them will have heavy bleeding, and others will be given IUD. And so they get discouraged. They just stop. They don't go back. And then after 2 years, they get pregnant again. So you see, they all get pregnant in 2 years. So long as you are breastfeeding, they assume that when you're breastfeeding, you don't get pregnant. And for some women, it is true. But once they stop breastfeeding, they get pregnant. So the children are 2 years in between. So these are some of the things that we do. And but now with the family planning, the women, actually, they come in and they join the family planning. It is very difficult for a woman who is poor, thinking about how to get food, to remember to take this tablet every day. It's you and I will remember. But for them, it's not something. So they miss a pill, they get pregnant, they say, oh, family planning is not good. It's not true. So these are all the problems that we are working on, and hopefully one day we'll conquer all of these problems.
Great, thank you. I have let's just one final question for you, and as we wrap up, and then those of you who have questions can stay for a few minutes to engage further. So I'll give each of you a minute or less. And if someone were to come to you and say, listen, I'm interested in replicating your project, I'd like to learn from you, what is the one piece of advice you would give to that person? So in a minute or less, what's your key takeaway advice that you would give to someone who wants to replicate your successes? Anyone would like to start? Yes, Fatu?
I would say you go down to the grassroots level. Never start from the top. It takes you nowhere. Go down and try to understand your people. Try to understand them. Try to be part of the community and understand them, and then try to make them, to hear their problems first before, let them say what they want. Don't tell them what you want to do. I think that's the first thing you should do. If you impose on them, you don't get anywhere. Okay. Let them tell you what they want, and then you can now start off. This is what we have done, because when I went to them, I asked them, what can we do? This is my card, take it. Whenever you need help, when you think you are convinced that I should come to me. And they all from a group, and they came and they found out, and that's how we started. I think it's important to find out what they want and not what you want to do with them.
Okay, thank you. Vic?
Very similar answer, really. I think the first point to mention is that this takes long-term investment. into an area, into engaging with the community and winning their trust. It's not a quick fix in and out. So think about developing a long-term relationship with an area and with the community, firstly. Secondly, listen. Just listen to what the community tell you. They will give you the answers if you listen long enough and well enough. And thirdly, think holistically. Think holistically about the threats to an ecosystem. Think holistically about the needs of a community. And tackle those needs in an integrated way.
Okay.
So when Blue Ventures first got to Andavadoke, as a marine conservation organization, we thought, well, let's put in marine protected areas. Let's cut off, some of these, you put in some no-take zones around the areas of highest biodiversity, which is, really how a lot of conservation organizations do it. And of course, the local community said, heck no, we're not gonna do that. That's not a good idea. And so that's when the discussion about the octopus came about. And, octopus was the main commodity. It was something that we knew as scientists that they would be able to see a change in a very, very short time. And so I think that starting the discussion about management, conservation management, at a very small steps, through very small steps, and on those species that were the most important to the community. And then, following that, several years later, we reapproached this idea of marine protected areas, the no-take zones, and then they were much more open to the idea. They understood what management looked like. So starting small.
Wow, thank you. What a rich dialogue. Thank you for your really good questions. All of this is being captured, and the presentations are all accessible to you. We will have the video of the presentations as well as a write-up. So please visit our website at wilsoncenter.org to have a look at the session today and other similar sessions, and also have a look at our blog, newsecuritybeat.org, and of course, follow us on Facebook and Twitter. Well, let's put our hands together to thank our panel. Fatou, Vic, and Cram, this has been a wonderful discussion, and they're going to hang around for a few minutes. I know there were a couple other questions that we didn't get to, so please come up and feel free to chat further. So thank you.